suppose I probably always knew I wanted to get into some form of teaching. I definitely didn't want to do anything like primary school or secondary school teaching because I loved nursing, I love looking after people. You've got to have the passion for it, definitely. It's one thing being a nurse, but to actually give that experience and skills to someone else and be a teacher and deliver that, you have to have passion, you have to want to do this. It's not something that you can just wake up one morning and say, I want to be a teacher. We have clinical educators in the NHS that are specifically to do with surgery, in the emergency department, intensive care unit. So the way they usually go about their role is that they are a nurse to start with, or it might be that they're a physiotherapist, a specialist in their area. They will work clinically with patients for several years. You've got to have a good bit of experience behind you. And then usually, but not always, some form of teaching experience. So you can usually do those within house. One of the really good things about my job is that when we get a student come in, some of them have never been in hospital before, they've never met patients before, they've never seen ill patients before, and it can be really, really nerve-wracking. One of the good things about my job is using my experience as a nurse. Being a parent as well helps as well, and trying to get some of those anxieties relieved from them. And then from a medical point of view and an academic point of view, just helping them step by step how to get from something where they've never picked up a needle before to become really competent, give them that motivation, give them hints and tips about how to maybe speak to a patient, how to approach a nurse for the first time. And it's really satisfying that after the end of maybe 3-4 years, you find someone who was really, really anxious to then becoming a really competent practitioner, and seeing that journey and helping them along that journey is absolutely fantastic, and it's really, really rewarding, really rewarding. You need to want to be it, and you need to be good at mixing with different people from various different backgrounds, various different ages. They've come from different extremes of life. You've got to be very, very adaptable, and you've got to show a lot of empathy as well. You've got to be very patient. I think you need to be extremely organised to be a clinical skills educator, or a clinical educator of any description really. And the reason for that is you do have a lot of plates spinning at the same time, and if you do get into a management position as well, you've got that added responsibility. You've got to be very, very good at time management and workload management. I've got 100 plus students, 3 members of staff. The skills and the programme have to be delivered at a set time in a set way. You've got to have some very good organisational skills, and if you don't, that is a very, very big challenge. I initially got my Bachelor of Arts in Honours degree in Nursing Studies from Sheffield Hallam University. So I went straight from sixth form, went to university and did that for 3.5 years. I then nursed for about 10 years on mainly surgical wards, and as I said, looked after nursing students and various things there. What do I get out of the job is usually good satisfaction that a student has come in not knowing anything and has left with both theory knowledge, the underpinning as to why we're doing it, and the actual physical skill of how to perform a skill. That's a fantastic feeling. It's then even better when you see those assessments coming in from clinical practice that they've actually done them under supervision on a real patient, being part of that patient's care, and yeah, that's a fantastic feeling that you've actually contributed to that.